Dear colleagues from around the world, thank you very much for attending this webinar about non-surgical rhinoplasty. I would also like to thank the Aesthetic Multispecialty Society for giving me this opportunity and personally thank Ms. Madeleine Farrand for making this happen. Let's start with the anatomy of the nose. The nose is a pyramidal structure, it has a very complex anatomy. It is located centrally in the face and is composed by skin, mucosa, bone, cartilage, and supporting tissue. Let's start with the bony cartilaginous part of the nose. So the upper third of the nose is consisted of the nasal bones. We all know them, we can all palpate them. The lower 2/3 of the nose are consisted of cartilage. So we have the lateral cartilages here, which are divided or connected, if you like, from the septal cartilage. And we have the major alar cartilage with its lateral crus and with its medial crus, which together with the lower part of the septal cartilage form the columella. So bony part, cartilaginous part. We have to know some specific anatomic areas when we want to perform the non-surgical rhinoplasty. One of them is the radix. The radix is the area where the forehead meets the dorsum of the nose, so this area. There are a lot of doctors who have different techniques, and those of you who do perform the non-surgical rhinoplasty, I'm pretty sure that you have developed your own technique and that you have changed and improved your technique as you perform more and more non-surgical rhinoplasties. I will talk to you about the theory of the technique, about how to augment the radix or the dorsum, how to camouflage a dorsal convexity, or how to improve the tip projection or the tip rotation. But I think that wouldn't be very interesting for you. So I had two options. I could either share one of my own videos where I perform and show the non-surgical rhinoplasty. I have posted many of them on my Instagram account, but I had a much better idea. And now this is the surprise part that I wanted to mention, that I wanted to tell you about.
And then we inject with the hand, with other hand. Because of this point one, we indicate to the patient 40 hours without glasses. So let's see it in a video. I enter in the radix. With the other hand, I compress the nasal dorsal artery. I put the syringe at 60 degrees. I aspirate, always aspirate, and inject a bolus of 0.05 ml supraperiosteal. Point 2. We enter by the rhinium. The syringe, again 60 degrees. We aspirate, always. We pinch the skin with the other hand, so we raise the arteries and lower the vascular risk. And we inject 0.025 ml supraperiosteal bolus. Point 3. We enter by supratip towards to the columella. The injector hand resting on the forehead. That way, the syringe remains at 45 degrees. We enter in the super.
Any tricks or tips for patients with a deviating nose so it appears straighter? Well, it all comes down to the deviation. If you have a deviation in the lower part of the nose, if you have a deviation of the cartilaginous part of the nose, so if your nose